Hand tremor can be an unsettling experience, especially when it appears suddenly or without an obvious cause. In this video, we'll guide you through the safest ways to respond to hand tremor at home before you're able to seek medical advice. Understanding what to do in the moment can help you stay calm and avoid unnecessary panic. We'll cover practical steps, what to watch for, and when it's important to get urgent help. Let's start by understanding what a hand tremor is and why it might happen. A hand tremor is an involuntary, rhythmic shaking of the hands. It can be caused by a variety of factors, ranging from temporary issues like stress or fatigue to underlying medical conditions such as essential tremor, Parkinson's disease, or thyroid problems. Sometimes, medications or caffeine can also trigger tremors. Recognizing the nature of your tremor is the first step in responding safely. Is it constant, or does it come and go? Is it mild or severe? These observations will help you and your healthcare provider later. The first and most important step is to stay calm. Anxiety can make tremors worse, so take a few deep breaths and try to relax. Sit down in a safe place where you won't risk falling or dropping anything. Observe your symptoms. Are you experiencing any other issues like weakness, numbness, or trouble speaking? If so, these could be signs of a more serious problem, and you should seek emergency help. Otherwise, continue to monitor your tremor and keep calm. While most hand tremors are not emergencies, it's crucial to check for warning signs. If you notice sudden weakness, numbness, difficulty speaking, confusion, severe headache, or loss of consciousness, call emergency services immediately. These symptoms could indicate a stroke or another serious condition. If you don't have any of these symptoms, you can continue to monitor your tremor at home and follow the steps we'll discuss next. If you're not experiencing emergency symptoms, find a comfortable place to sit and rest. Sometimes, tremors can be triggered by fatigue or overexertion. Give your body a chance to relax and recover. Avoid standing or walking if you feel unsteady, as this can help prevent falls or injuries. Resting can also help you better observe your symptoms and determine if they improve with time. While you're experiencing a hand tremor, it's best to avoid activities that could be dangerous if your grip is unsteady. This includes cooking with hot pans, using sharp objects, driving, or operating machinery. Wait until the tremor subsides or you've received medical advice before resuming these activities. Your safety is the top priority, so don't take unnecessary risks. Caffeine and other stimulants can sometimes make tremors worse. If you've recently consumed coffee, tea, energy drinks, or certain medications, consider whether these could be contributing to your symptoms. Avoid additional caffeine or stimulants until you've spoken with a healthcare provider. Drinking water and choosing calming herbal teas can be a safer choice while you monitor your symptoms. Low blood sugar can sometimes cause hand tremors, especially in people with diabetes or those who haven't eaten in a while. If you have a blood glucose monitor at home, check your blood sugar. If it's low, eat a small snack like fruit juice, crackers, or a piece of fruit. If you don't have diabetes but feel shaky, eating something light can still help. If symptoms persist or worsen, seek medical advice. Dehydration can sometimes contribute to muscle tremors. Make sure you're drinking enough water throughout the day. If you've been sweating, vomiting, or have had diarrhea, you may need to replace lost fluids. Sip water slowly and avoid sugary or caffeinated drinks. Staying hydrated supports overall health and can help reduce the severity of tremors. Some medications can cause tremors as a side effect. Review any new or existing medications you're taking, including over-the-counter drugs and supplements. If you suspect a medication is causing your tremor, do not stop taking it abruptly. Instead, make a note and discuss it with your healthcare provider as soon as possible. Stopping some medications suddenly can be dangerous, so always seek professional advice first. Stress and anxiety are common triggers for hand tremors. Try relaxation techniques such as deep breathing, meditation, or gentle stretching. Find a quiet space, close your eyes, and focus on your breath for a few minutes. Reducing stress can help calm your nervous system and may lessen the tremor. If you find it difficult to relax, consider listening to calming music or practicing mindfulness exercises. Keeping a record of your symptoms can be very helpful for your healthcare provider. Note when the tremor started, how long it lasts, what you were doing at the time, and any other symptoms you notice. If possible, record whether the tremor affects one or both hands, and if it changes with movement or rest. This information will help your doctor make a more accurate diagnosis when you seek medical advice. If you live with family or roommates, let them know what's happening. Having someone nearby can provide reassurance and assistance if your symptoms worsen. They can help you monitor your condition, assist with daily tasks, or call for help if needed. Don't hesitate to reach out, especially if you feel unsteady or anxious. Alcohol can sometimes worsen tremors or interact with medications you may be taking. It's best to avoid drinking alcohol until you've spoken with a healthcare provider. If you have a history of alcohol use or withdrawal, let your doctor know, as this can also cause tremors. Staying alcohol-free is a safe choice while you monitor your symptoms. Sometimes, tremors can be a sign of infection, especially if accompanied by fever, chills, or other symptoms. Take your temperature if you feel unwell. If you have a high fever, confusion, or other signs of infection, contact your healthcare provider promptly. Treating the underlying infection may help resolve the tremor. Keep an eye on your symptoms over time. Is the tremor getting worse, staying the same, or improving? Are new symptoms appearing? Monitoring for changes can help you decide when to seek medical attention. If the tremor persists for more than a few hours, becomes more severe, or is accompanied by other concerning symptoms, contact your healthcare provider. If your tremor is mild and not accompanied by other symptoms, gentle hand exercises or stretches may help. Slowly open and close your hands, rotate your wrists, or gently massage your palms. These movements can sometimes reduce tension and improve blood flow. However, stop immediately if the tremor worsens or you feel pain. Physical exhaustion can sometimes trigger or worsen tremors. Avoid strenuous activities or heavy lifting until your symptoms have resolved or you've spoken with a healthcare provider. Focus on rest and gentle movement instead. Overexertion can also increase your risk of injury if your grip is unsteady. Make sure your living space is free of hazards that could cause falls or injuries if your tremor worsens. Clear walkways, secure loose rugs, and keep frequently used items within easy reach. If you need to use stairs, hold on to the railing. Taking these precautions can help prevent accidents while you monitor your symptoms. If you have a history of medical conditions that can cause tremors, such as epilepsy or diabetes, consider wearing a medical alert bracelet. This can help first responders or others understand your condition if you need urgent help. Keep important medical information easily accessible at home as well. It can be tempting to take over-the-counter medications or supplements to try to stop a tremor, but this is not recommended without medical advice. Some substances can interact with your current medications or worsen your symptoms. Always consult a healthcare provider before starting any new treatment. If your hand tremor lasts more than a few hours, recurs frequently, or interferes with daily activities, don't ignore it. Persistent tremors can be a sign of an underlying medical condition that needs evaluation. Make an appointment with your healthcare provider to discuss your symptoms and get a proper diagnosis. When you're able to see a healthcare provider, bring your symptom notes and a list of your current medications. Be ready to describe when the tremor started, how it feels, and any other symptoms you've noticed. This preparation will help your doctor make an accurate diagnosis and recommend the best treatment. Understanding your own medical history can help you and your doctor identify possible causes of tremor. Consider any past neurological issues, thyroid problems, or family history of tremors. Share this information with your healthcare provider during your visit for a more comprehensive evaluation. Essential tremor is a common cause of handshaking, especially in older adults. It usually runs in families and often gets worse with movement. Other causes include Parkinson's disease, medication side effects, anxiety, or metabolic issues. Your doctor will help distinguish between these based on your history and symptoms. If your hand tremor is accompanied by sudden weakness, numbness, vision changes, trouble speaking, severe headache, or loss of consciousness, seek emergency medical care right away. These symptoms could indicate a stroke or other serious condition. Don't wait, call emergency services immediately if you notice any of these warning signs. It's important to remember that most hand tremors are not life-threatening and can be managed safely at home until you get medical advice. Staying calm, monitoring your symptoms, and following the steps we've discussed will help you stay safe and comfortable. Your healthcare provider will guide you on the next steps based on your individual situation. Make sure you have emergency contact numbers easily accessible at home. Save them in your phone and keep a written copy in a visible place. This ensures you or someone else can quickly call for help if your symptoms suddenly worsen. Being prepared can make a big difference in an emergency. If your tremor makes it difficult to hold objects, consider using supportive devices like cups with lids, utensils with larger handles, or non-slip mats. These simple adaptations can help you stay independent and safe while you wait for medical advice. Ask a family member to assist with tasks that feel unsafe. Avoid driving or operating heavy machinery until your tremor has resolved and you've been cleared by a healthcare provider. Tremors can affect your ability to control a vehicle safely, increasing the risk of accidents. Arrange for alternative transportation if you need to go out. Keep in touch with friends or family members, especially if you live alone. Regular check-ins can provide reassurance and ensure someone is aware of your condition. If your symptoms change or worsen, let them know right away so they can help you get the care you need. A symptom diary can help you and your doctor track patterns and triggers for your tremor. Record the time, duration, and circumstances of each episode. Note any foods, activities, or emotions that seem to make it better or worse. This information can be invaluable for diagnosis and treatment planning. Mindfulness techniques, such as focusing on your breath or sensations in your body, can help reduce anxiety and may lessen the severity of tremors. Try sitting quietly, closing your eyes, and paying attention to your breathing for a few minutes. This can help you feel more in control and less distressed by your symptoms. It's natural to feel embarrassed about a hand tremor, but hiding your symptoms can delay getting the help you need. Be open with your family, friends, and healthcare provider about what you're experiencing. Early intervention can lead to better outcomes and peace of mind. While it's helpful to research your symptoms, avoid spending too much time online searching for causes or self-diagnosing. This can increase anxiety and confusion. Use reputable sources and focus on the practical steps you can take at home until you get professional advice. Even if your tremor seems mild, don't delay reaching out to your healthcare provider. Early evaluation can help identify the cause and prevent complications. Call your doctor's office or use telemedicine services if you're unable to visit in person. Never take medications prescribed for someone else, even if they have similar symptoms. What works for one person may not be safe or effective for you. Only use medications that have been prescribed specifically for you by a healthcare provider. Hand tremors can be stressful and may affect your mood or mental health. If you're feeling anxious, depressed, or overwhelmed, consider reaching out to a mental health professional. Taking care of your emotional well-being is just as important as your physical health. Avoid trying unproven or alternative remedies for hand tremor without consulting a healthcare provider. Some products may be unsafe or interact with your medications. Stick to evidence-based approaches and wait for professional guidance before trying anything new. Lack of sleep can worsen tremors and overall health. Aim for a regular sleep schedule and create a calming bedtime routine. Good sleep hygiene supports your body's ability to recover and may help reduce the severity of tremors. Proper nutrition is important for nerve and muscle health. Eat balanced meals with plenty of fruits, vegetables, whole grains, and lean proteins. Avoid skipping meals, as low blood sugar can trigger tremors. If you have dietary restrictions, consult a nutritionist for guidance. Staying hydrated is essential for muscle and nerve function. Drink water regularly throughout the day, especially if you're active or in a hot environment. Dehydration can worsen tremors, so make hydration a priority. If you have known medical conditions like diabetes, thyroid disease, or neurological disorders, manage them as directed by your healthcare provider. Poorly controlled chronic conditions can contribute to tremors. Take your medications as prescribed and keep up with regular checkups. Some tremors, like essential tremor, can run in families. If you have relatives with similar symptoms, share this information with your healthcare provider. Family history can provide important clues for diagnosis and management. To sum up, the safest way to respond to hand tremor at home is to stay calm, monitor your symptoms, avoid risky activities, and seek medical advice if needed. Most tremors are not emergencies, but it's important to know when to get help. By following these steps, you can keep yourself safe and prepared until you receive professional guidance. Remember, you're not alone. Help is always available.